original building created a sense of fortress, of isolation, of oppression.
I was using and selling drugs from the time I was 22 till I was 30-something.
What is going on so that so many people are hungry and so many people are without housing or struggle to pay their rent.
How do you build a healthy community? The way we've always done it, one story at a time.
I think we are seeing a change in looking at how the environment that surrounds people affects their health.
It was an oppressive environment. It was dark and dank and closed in, and the people lived that way. They felt that they were trapped. They felt they were disconnected.
These people were probably more likely to be sick. If we compound that problem with houses that are not healthy, we are going to actually increase the cost of healthcare in the future, especially among people who are living in affordable housing.
Amongst the Carlton Hart Reach LMC team, we actually thought about everything we did out here in terms of how it affects the residents, their sense of community, and their sense of connection to the neighborhood. It really helps the residents connect with the environment and connect with the idea that they are part of the environment. Whether it's understanding how a bioswale works and what it's doing with the rainwater, or participating in growing their own food, it really develops that sense of connection to the environment.
Looking at the tomatoes, they haven't. I had one that turned red. The baby cherry ones, they're all turning red.
Our understanding is that the happy monitor has gone up. that people are happy living here now.
I was thinking of building a ramp on my home as my MS was progressing, and it was getting harder and harder for me to climb the stairs. And so I had someone come out and give me a quote, but it was way over what I could afford.
One of the key parts that we have tried to emphasize is aging in place.
I would have had to face probably the sad reality of being placed into a care facility.
Whenever we take a community member outside of that community, we both lose. We lose that person who knew the system, and that person loses the entire support system that she or he had created for her entire life. So it is to our advantage that we maintain the people who contribute to this community to stay in the community.
In fact, I visited someone recently in a nursing home who has the same thing that I have, and I got to see the contrast of being independent and being dependent. And so I think independence allows you to still have your own life, be your own person, do your own thing, be a part of society, contribute. Reach, again, became a lifesaver for me. They just came out of nowhere, all these cars, all these people, and we just had the most wonderful day. I got to meet all these cool people. I mean, to think that I couldn't get out of my house if it wasn't for the ramp. Wow. And now my neighbors tell me all the time, you go more than anybody, and you can't even walk.
I worked, I had jobs, then I had a baby at 19, and her father took her from me when she was 1.5 years, and about 2 months after I realized I wasn't getting her back, I started using drugs because I didn't want to feel it.
The women who live at the Rose have come from homeless shelters around the city. So many women have come from situations of domestic violence. Some women are chronically homeless, have been dealing with addiction issues or long-term chronic health issues that have kept them on the streets for a long time.
I was tired of living the life of drugs. I was just tired of it. Tired of selling them, tired of using them, tired of ending up in jail. And I thought if my daughter ever finds me, I don't want her to see this.
We just finished up a class the other day, and actually Shelley was in that class, and we asked what she liked about it, and she said, you know, it was one of the first times in a long time where she felt like people cared what happened to her.
The Healthy Homes class is healthier ways to live in your community, like for pest prevention and green household products.
The cool thing about that class is it's based on an empowerment model. So we are teachers but also learners, and all of the residents were learners but also teachers, and we worked together to cover the material that we wanted to cover.
My whole life, I've lived in this building the longest of anywhere I've ever lived my whole life, even as a child. If you don't have stability, you really don't have much else. And when you know that you have somewhere to go to that nobody can take away from you unless you mess up yourself. Now that I have housing, I want to be a normal person. I don't want to be a statistic anymore. I want to have a job. I want to have my daughter in my life.
These problems that we face are they're so big and long term, and the way to fix them, I think, is to really help individually on a personal level people to overcome that and to transform their lives. And it takes time and it takes relationship building, but it works.
Do you ever get to see her?
I just do now. We just got in contact. I talked to her, and I have 2 grandbabies, and I just love her to death. And I get to kiss my daughter and touch her and hear her voice.
So you have a relationship with her?
Yes.
Oh, good.
And I couldn't have had that if I didn't have housing.
A lot of kids my age, and just kids in general, they don't really think about the future. Some kids spend all their money on one thing that they really want right in that moment, rather than, oh, you know, I want to save for a bike. I need transportation. My mom introduced me to Reach and talked about YouthSave with me, and I was super, super excited for the next year. It's really important for people who especially are low income, to learn how to manage money and how to save for those things that you really want.
This year I'm going to save for horseback riding lessons and voice lessons, because I love to sing.
First year I saved for a sewing machine, then I saved for a camera, and then I saved for a computer, then I saved for a bike. This year I'm saving for ACT and SAT tests. There's just this sense of like, I did it. I accomplished this giant goal that I've been waiting 9 months to get, and now I have it, and it's like, yes, I got it.
How do you build a healthy community?
So we need to realize that we're all connected in this.
If we develop strong communities, then we become less reliant over time on taxpayer-funded programs that institutionalize people or institutionalize the services that they receive. If we can get people to support each other, then we have to pay less for the services that those people might need down the road.
So let's build something together.
Because the more people that are successful in a community, the better the community, no matter how they get that way. I mean, why should only a select be successful and always have to help the ones that aren't? If they're successful too, they can help themselves.
All it takes is ingenuity, passion, focus. All it takes is reach.
So we're hoping you could sing something for us?
Ha! Yeah, right. Sing something. Yeah, you want the neighborhood to leave?